If you think of veterinary medicine as kind of like a maze where you're trying to find your way through and you're working with a tour guide that doesn't speak your language, what predictive analytics and predictive diagnostics can do for you is help you fill in those gaps and fill in those spaces and figure out what paths are open to this pet and what they might be at risk for.
So what predictive analytics do is they take large amounts of data and they look for very specific patterns. And so as more data gets fed into these augmented intelligence or artificial intelligence models, that information helps to actually train these models. So every piece of information makes basically the tool, the predictive tool, smarter. So rethink is the veterinary industry's first predictive diagnostic tool, and it uses an algorithm that's been developed from a large amount of data, over 150,000 pets, more than 20 years of electronic medical records. And with that information, we are able to predict whether a cat can develop chronic kidney disease up to 24 months with a greater than 95% accuracy.
So on the genetics side, we have introduced the Wisdom Panel Health genetic test into Banfield's puppy wellness plans. And so we've tested almost 200,000 puppies in the last year. And with that information, we are powering the veterinarians to identify those pets that are at risk for genetic diseases within their lifetime, and especially flagging the ones that can impact their care today. Be it, like I said, a bleeding disorder, a drug sensitivity, things along those lines. And we have identified about 5% of those 200,000 dogs that are positive for one of those mutations, the select number that will impact them very early on in their care. So that's allowing those veterinarians to intervene early and avoid problems down the line.
It's a paradigm shift in terms of how we've traditionally practiced, but it is a shift that I think we've wanted as veterinarians, because we have wanted to be able to try to do as much as we can. We're living longer, so we want our pets to live longer. And so I think it's a positive change. And in fact, our early adopters are enthusiastic, right? They're inspired, they're excited. It's allowing them to really engage with pet owners at a much deeper level.
So 10 years down the line, I envision we will have a lot more predictive diagnostics, genetics, as well as AI-based tools like renal tech and goodness knows what by then. But ideally, we will get a very complete map for our patients from day one and have a lot more information going forward so that we can create a very specialized and unique care and wellness plan for that pet.
So the future is, as we have more and more of these predictive analytic tools combined with sort of our advancements in medicine and knowledge and science, the integration of that, of how we have grown as doctors, I think it's going to be incredibly powerful, and it's going to actually change the way we practice medicine even more. But it's actually going to change the way we look at our pets and the things we can do for them, and it's going to change the industry overall. So I think this is like an exciting time.
Well, certainly if our viewers want to learn more about the science that Mars Pet Care is developing, we encourage them to visit the Waltham Pet Care Science Institute website at waltham.com, or to learn more about Wisdom Panel, wisdompanel.com, and certainly renal tech at antechdiagnostics.com.